Well, good afternoon, everyone. We have in Ohio a new confirmed case, 55-year-old male from Trumbull County. Has no travel history, outside the state of Ohio. He has been hospitalized. Fortunately, he did not go to work when he developed these symptoms. He felt sick. As we have talked about and as yet medical experts have explained to us, these numbers are just going to continue to grow. And we know that these confirmed numbers are only a small fraction of the individuals who are infected already in the state of Ohio. Further, we believe that this is, in all likelihood, all throughout the state of Ohio. These numbers will grow. Dr. Acton will talk about this in a moment, in a few minutes, but we are told by medical experts that whatever the number is today, it will double in 6 days. And then that just continues on and on and on. Let me make a few announcements. The call center that you all visited, those of you in the press had the opportunity to visit, has now been moved. People were much too cramped in. It's not just a question of convenience. It is a question of their safety. People should not be working that close. And so they have now a big room, a large space. And again, I would emphasize that what we're looking as we go through this crisis, we're looking for people to be able to stay six feet apart. That is the safest way to be. So it's important we do that. We announced yesterday some new regulations, new orders in regard to our nursing homes. The reaction from the nursing homes has been that we need more restrictions. So we will be, within the next several days, issuing regulations that will stop visiting at our nursing homes. This is not something that we want to do, but no one knows the safety of their patients better than the nursing homes themselves. Again, what I would say to all Ohioans is this will not last forever. This is temporary. Everything we're doing is temporary. We will get back to normal in Ohio. It's not going to be done overnight, but we will. Let me also announce that Director Lloyd Chris is ordering in regard to our state psychiatric hospitals that there be no longer any visitation. No visitors. She will have a complete order later in regard to that. It will be similar to the checking that's going on in our nursing homes. People that have to be there, they will be checked for their temperature. These people coming in, it will be restricted as much as practical. Let me talk now about the large gatherings that are occurring in Ohio. In a moment, Dr. Acton will be signing an order banning the gathering together of people, over 100 people. So this is an attempt to make sure everyone understands that we cannot be gathered together. We cannot be in close proximity to each other. Let me read from the order. And then this order will, of course, be available for the news media. Mass gatherings are prohibited in the state of Ohio. The order reads, mass gatherings are defined is any event or convening that brings together 100 or more persons in a single room or single space at the same time, such as an auditorium, a stadium, an arena, a large conference room, meeting hall, theater, or any other confined indoor or outdoor space. This would certainly also include parades, fairs, and festivals. For the purpose of clarity, a mass gathering does not include normal operations at airports, bus and train stations, medical facilities, libraries, shopping malls and centers, or other spaces where 100 or more persons may be in transit. It also does not include typical office environments, schools, restaurants, factories, or retail or grocery stores where large numbers of people are present. But it is unusual for them to be within arm's length of one another. A mass gathering also does not include athletic events that exclude spectators. Athletic and other events do not need to be canceled or postponed if spectators and other attendees are excluded. The order does not apply to or exclude immediate family members of participants in the athletic or other events, as well as anyone necessary for the event to take place. The order does not exclude the media, and there's more to it, but that is the basic essence of it. Well, in fact, let me read a couple more. The order does not apply to or exclude religious gatherings for the purpose of the expression of First Amendment protected speech, weddings, or funerals. Dr. Acton, if you will sign that. Lawyers get through with everything, it gets a little more complicated here. 4 pages. There you go. Thank you very much. One thing I want to emphasize is that government can only do so much and only should do so much. We can make these orders about mass gatherings, but it really is incumbent upon all of us to protect all of us. It's incumbent upon us to protect our family members, our loved ones, but it's also incumbent upon us to protect total strangers. For example, order does not cover this, but we would hope common sense would. 25-year-old decides that since he was planning on going to the NCAA, can no longer do that in person. He obviously wants to watch it on TV. March Madness is not much better in sports. But he decides he's going to go to a bar, sports bar. And when he gets in that sports bar, people are shoved in pretty tightly to one another. He leaves, has a good time. That night decides to go visit his 85-year-old grandmother. That's not a smart thing. What we all have to understand is while the 25-year-old, I knew how I felt when I was 25, and I was invincible. Most young people think they're invincible. And that's fine. He can make that choice for himself. But we know that the mortality rate goes up dramatically when we hit 40, 50, 60, 70, 80. Mortality rate, we don't know the exact numbers, but could be as high as 15% for an 80-year-old. So that is not a smart thing to do. And so these orders and all the things that we're talking about is putting separation between people, social distancing. Not sure I'd heard that term before the last few weeks, but I've learned it. So each one of us has that obligation. And you can't put out orders that cover every situation. But the key here is for people to not only protect themselves, but protect others. Let's say that 25-year-old has a girlfriend, and that girlfriend has a grandmother, and the grandmother has a friend, and we could go on and on and on. And that spreads, that's the way it spreads. And if every person as we're told, who is infected will infect at least 2 other individuals, this thing just goes on. And if it turns over every 6 days, doubles every 6 days, you can see the importance of what we're trying to do, but even more important than what we're ordering, what's important is how people take care of themselves and take care of each other. We are in this together, whether we like it or not. I have seen Ohioans, and I've been along the Ohio River when we've had communities that have flooded. I've been to places where there have been tornadoes. I've been to Dayton when the mass shootings occurred. And I've seen every single time Ohioans come together. And I've seen every single time Ohioans take care of each other. And so that's what we all have to do. We have to take care of each other as we move forward. And look, we're going to get through this. But we got to go through this gauntlet. We got to run this gauntlet. And we got to try to get through that gauntlet without losing too many of us. And so everyone has to think about other people. That's why this is so very important. Let me move to another subject. I'm going to have Lieutenant Governor talk about this for a moment as the former Secretary of State, but voting is coming up next Tuesday. We want everyone to vote. I plan on voting tomorrow. My wife Fran tells me she voted at 1 o'clock today. She went in the Greene County Board of Elections, and there was 2 people there, only 2 people. So this is a great opportunity with early voting for people to have the opportunity to go vote. Pick a time of the day that might not be as many people. We're holding this election. It's right that we do so. It's important for our country to move forward. But there are opportunities in the state of Ohio for people to vote in many, many different ways. John?
Thanks, Governor. Earlier today, I spoke with Secretary of State Frank LaRose to talk through Election Day and the issues that he and the local boards of elections and the up to 30,000 poll workers in the state are preparing for. Let me just reiterate what the governor said. Early voting is an option for you. Take advantage of it if that is the best way for you to do it. Voting does not meet the definition of a mass gathering. Election Day will go on as planned. One thing that I know Secretary LaRose needs is that there are some poll workers who fit into the category of having unique health limitations, and so they will not be present as poll workers on Tuesday. And so they are attempting to secure more poll workers for Election Day. Poll workers are always an issue. You can do that at voteohio.gov/defenddemocracy, which is the Secretary of State's website. That you put in your name and your address, and they will connect you to the local Board of Elections to help secure you as a poll worker for Election Day. We urge people who are willing to do this, they're what I consider patriotic and civic duty of coming together at a time of need. They can do that at voteohio.gov/defenddemocracy. Already, Secretary of State LaRose informed me that they've had 500 people sign up to help fill in for Election Day. I know that we are encouraging that among state employees who can assist in this. But I want to reiterate, Election Day is not considered a mass gathering. There are some poll workers who, because of unique health situations, will not be able to participate, and so we need poll workers. And please help your community, your elections officials, and the Secretary of State by signing up. Thank you.
Thanks, John, very much. We had a cabinet meeting this morning and talked about how we move forward. And the state needs to set an example. We are already seeing many businesses, almost by the hour I get an alert where a business has decided everyone should work from home. So I have instructed our members of our cabinet to make that assertion determine among their employees who can work from home. Obviously, some state employees cannot work from home. We have prisons to run. We have other things to do. But if they can work from home, I've asked that the members of our cabinet start that process. I have a request from Jobs and Family Services to make a plea to the public not to come in person. Again, we're trying to cut down on contacts. So most of the contacts with Jobs and Family Services could be done over the phone. It couldn't be done online. Obviously, if it's an emergency and there's some reason it has to be done in person, they're open for business. But we're trying to cut down on contacts. Let me talk for a moment about price gouging. The Attorney General is prepared to enforce the law in the state of Ohio in regard to unconscionable sales. That's what it's called in the state of Ohio. That's what the statute was. And so I guess just as a statement, people are thinking about maybe making more than the usual profit. They need to kind of consider that. And we would ask people again to remember we're all in this together. We're all in the same boat. The faster we can get through it, the better. So I ask people to think about that as well. Let me now ask the Lieutenant Governor to come back. We're sending a letter to the President of the United States in regard to regulations. We are at a time when certain things that might be mandated as far as inspections by the federal government, regulations, it is not in the best interest of the people of Ohio to continue those. Inspections, for example, in a residential facility where the person who's doing the inspection might be going from place to place to place and then become a carrier. So, John, you want to talk about that?
Sure. Thank you, Governor. This is consistent with the medical advice that we have been receiving from medical leaders like Dr. Acton to take the necessary precautions to limit any non-essential person-to-person contact. This will impact, when you're talking about state employees, the ability to timely inspect, regulate, and process compliance with both federal and state regulations. And as such, we are preparing a letter to President Trump and Vice President Pence asking them for latitude in compliance and enforcement of federal regulations for state agencies and business. We have a number of agencies that regulate regulate, inspect, offer licenses, and so forth, with a variety of businesses and government entities, and they need latitude consistent with the medical advice that we are receiving. Similarly, we are asking our state agencies to identify these same issues at the state level for businesses and local officials so that we can provide the same relief from the timeliness of state regulatory compliance. We are urgently working with the business leadership of Ohio and our state agencies to identify additional opportunities to provide relief and support for businesses that will be critically impacted by this pandemic. Just as we are trying to limit the health consequences of COVID-19, we are also seeking to address the economic impact that will result due to this pandemic. And so we are working to provide that support and that relief so that we can both take smart medical and health advice and also minimize the economic impact, because we know that the restrictions that come as a result of the COVID-19 pandemic, that there are going to be great stresses on business, and we want small businesses to know, and the people who work for them, that this is on our minds. We are working to identify in as quick a fashion as possible how the state and federal government, in coordination with local government, can help minimize the impact on them. Thanks, Governor.
Thank you, John. Just as we ask individuals to use their common sense, make rational decisions, as John said, it's also important for the state government to do that, local government to do that, and the federal government as well. We must treat this like what it is, and that is a crisis that we have not seen, most of us, in our lifetimes. Let me turn now to our schools. From what we can tell, based on what's happened in other states, based on what has happened in other countries, unless a child has a medical problem, the risk of death for that child is not very high. But children are carriers, and you can call them potential carriers. There's probably a more accurate way to say it, but just as an adult is a potential carrier, just as anyone in a school system or any place else in Ohio is a potential carrier, so are children. And schools are what they are. It's kind of the one thing we've all had in common. We've all gone to school, and we know what schools are like, and we know that people are come together a lot. And so there is a great concern. And we have today, again, consulted the best minds that we can consult. So we are announcing today that children of the state will have an extended spring break. The spring break will be of duration of 3 weeks, and we will review it at the end of that. This will begin this coming Monday, close of school that day. Each school will determine access to the building after that. We would certainly anticipate in talking to educators that teachers would need access. We will continue to consult with educators about this, as we have been doing, and we've been very helped and informed by the educators that we have talked to. We have to take this action. We have to do everything that we can to have an interruption. We have to do everything that we can to slow down the spread of this virus. We know that it will continue to spread, but slowing it down will enable our healthcare providers, our hospitals, our doctors to be able to stay up with the medical problems that this virus is causing, as well as to stay up with people's normal heart problems and any other problems that they might have. We do not want to be in a situation where our medical providers are making life and death decisions of who lives and who dies. That is something that is simply unacceptable. And so this action is not an action that I took lightly, but is an action that we are confident is the right thing to do. We do close schools at other times. I'm not minimizing the impact this has on families. change in plans, families who both parents work. We thought long and hard about that, and we understand the sacrifice this is going to entail. But this is the best medical advice we can get by people who study viruses, and we know it's the right thing to do. We have been working, as I know schools have, to make sure that some of the services, the non-academic services that kids get, such as food, that will be able to continue. Those are things that are important. We also know that educators have been planning and talking about this to see how they could have distance learning in some cases, and somehow handle keeping kids on a track as far as education. But we know it's disruptive. We know it's disruptive to the families. But we have to do this if we're going to slow this down. I'm going to turn now to Dr. Acton, who's going to talk a little bit more about the science behind all this. Doctor?
Good afternoon, everyone. This is certainly an unprecedented time. It is this 1 in 50 years pandemic that we've been planning for. We talk a lot about in my over 30 years in public health, but we have never seen a situation exactly like this. We talked yesterday about the steps we're taking and the playbooks we're following, but I really have to commend our governor, Mike DeWine, and our lieutenant governor. These are the hard decisions, and believe me, there's no one exact right, exact perfect. But the steps we're taking now will absolutely save lives, and I'll go over again why it's so important that it changes the impact on our healthcare system. First of all, we do have 5 positive cases. As the governor mentioned, our 5th case is a 55-year-old male near where I grew up, Trumbull County, and he is in the ICU. This is a man who has a family and kids who are also quarantined and many contacts, and our local health departments are busy at work letting folks know if they have been in contact with this gentleman. We have 30 negative tests, but as this moment when I came in, 52 people under investigation. And as I said before, those rings and rings are out there. I can't tell you the number of contacts. Right now it's in the hundreds that are also being told to self-quarantine. So this ripple effect I'm seeing spread throughout Ohio. It is in counties far and wide, and we do most definitely have community spread. Our lab, we are very fortunate to announce that we do have 2 more kits in addition to our 1 kit. That makes our capacity upwards of 1,200 to 1,500 people who can be tested, and our lab is going to 3 shifts now to help that testing process. We continue to man our phone line, so important for viewers at home, our 833-4-ASK-ODH. We continue to give you the latest information at coronavirus.ohio.gov. I know it is very, very hard for us to get our heads around this, and we're all sort of waking up to our new reality. And one of the things we're going to begin to put on our website, we began today, are a series of fact sheets and checklists to help you kind of figure out what is this new norm going to be like. So I really want people to stay tuned for that. You know, we are basically slowly shutting down most of our structures of society. We're asking people to stay at home in the hopes that they don't engage in this logarithmic spread of disease. As the governor said, that was such a key clue to this. It doubles every 6 days. And if you think about it, everyone who's not spreading it, me not spreading it to 2 to 3 other people, and those 2 to 3 other people going out, that is how we can slow this down. It's so crucial, the moves we're making in the next 2 to 3 days. In all our pandemic plans, we hope to do these measures I've talked about a little more slowly. But as we can see, we're in a crisis situation now. We're moving quickly. Taking decisive action now will greatly slow down this disease and stop this trajectory. So let me show you, once again, for folks who maybe haven't seen this. Again, our pandemic curve. We've talked about the fact that China was like this big yellow. My team has joked with me because I call it, would you like a big monster or a small monster? There's no scenario now where there's no monster. And again, our team has been planning for this pandemic curve all along. And every measure we're taking, even the president's new measures yesterday on travel, is meant to slow down the spread of disease, take longer for the entry because the entry will be amongst us. We know 40% and upwards of our population will eventually get this. But when we are slowing it down and we're decreasing that spread dramatically, what we're doing is, this was my black line, this is keeping the numbers low enough so that we don't overwhelm our hospital systems. State of the art, as they are, there are only so many ventilators. There are only so many ECMO machines, and they must be used wisely by the sickest patients, and therefore, every action every one of us takes is going to save lives. And this is serious. You know, I'm trying to be serious. This isn't panicky, because what we can tell you to do about it is really common sense. But each one of us will need to use that guidance and make those decisions of how we can help.
Okay.
Thank you. I think we need to begin to think about our households and not just ourselves as individuals. Dr. Fauci had said that if you have a sick or elderly person or someone with a pre-existing health condition like heart disease, lung disease, diabetes, obesity, a child who's on cancer drugs, you should act in your household as if you have this virus and take precautions similarly. Those are the kind of thoughts we need to do to make our decisions. I know this is hard because this virus is among us, but we can't see it yet. And therefore, we have to think of someone like a Tom Hanks. I can't think of a more normal and ordinary person to us, and that is us. We know now, just the fact of community spread says that at least 1%, at the very least 1% of our population is carrying this virus in Ohio today. We have 11.7 million people, so the math is over 100,000. So that just gives you a sense of how this virus spreads and is spreading quickly. The measures the governor is taking are very decisive and are really, really the measures you'll see fellow states making alongside of us. I want to speak to schools and businesses. This is a terribly hard decision. Schools are always the last thing you want to do. I am asking all philanthropies and all businesses to come alongside our schools and communities and our health departments to help in the days to come. This is going to take creativity on our part, but let me give you an example. Businesses need to be flexible to the extent they can with their non-essential workers. Say you are a parent who is at home. You can help make meals. We have wonderful backpack programs that are often when kids are on spring break, when winter break, during the summer. We have nonprofits that already do things to help these kids. Let's get them involved now. You can walk your dog. if you're out amongst nature, and we're going to need some, our chief estimates at this time from modeling say that this might peak in late April to mid-May. But you can be outside when you have that control over your environment and that assured distance from other people. You know, that's different than a mass gathering or sitting in a seat out of doors next to someone. You can garden, you can cook. You see in Italy where people go about, they make choices like going to the grocery store once a week during non-peak hours. So these are the sorts of tips and guidance we'll give you, because I think we are all, myself included, going to need to understand how to live in something we've never done. And I know kids in schools out there are watching this right now. My husband is a school teacher. Hello, Bexley. I know you're watching this. And there are things that you can do too to help out. And this is the thing, like not dropping off a meal at an elderly neighbor's doorstep. Or I'm going to go so far as to say, your local health department right now has been working 24/7 weekends since mid-January. They're on the front lines of this investigation. I'm sure they won't mind a plate of cookies dropped off. But these are the little things we will do, not unlike a 9/11, and folks have said this will be the thing this generation remembers. And so it is these acts of unity and community that will be creative, that you all will be inventing, that will help us get through this. So we know we have a couple long months ahead, but we will keep you apprised step by step. I want to echo the Lieutenant Governor, young, healthy poll workers, another great way. I know college students are out right now. I know you care about voting. Not only do I want you to vote, but I want you to get out there to the polls and help out, because we have a lot of elderly citizens, retired, who do this work, who really need to stay at home. I need to say something to my fellow doctors and primary care folks, the nurses on the front line, the CVSs, the urgent cares. We need to think about this disease very carefully. There is limited testing. Every one of us needs to do a good clinical diagnosis. This is a virus, this is an infection, and there isn't time for a CME course on this, but think of the flu, think of the common cold, and act as such. You really need to do a good history with each patient. You need to ask about travel history. You need to ask if they've been in contact with someone under investigation known to have this disease. If you need help with this, a local health department can help guide that. But honestly, we're so busy right now, we really need, once again, even as providers, to use good sense. I have heard that there are urgent cares who are turning away sick patients. This is the time we need everyone to stay outpatient. We need them not in our emergency rooms. We need everyone to step up. There's great guidance on our site. You'll be getting more through the medical boards and otherwise. We really need all providers learning how to take proper respiratory precautions. They're now droplet with a mask. We need you to see people, and folks, if you're sick and it's mild and you're relatively healthy, you really can stay home, because we need the sickest people right now going to our emergency rooms. I'll give you more guidance on that in the days to come. Our health systems doing the testing, many of our major health systems have set up things, but they need a doctor's order, someone on the front line deciding who can ride this out and who really needs emergency testing. They will make the recommendation, and there are drive-through accommodations the hospitals will provide you for, because they're trying to keep the testing out of the emergency room. So you'll learn more about that, but this is a call out to all my colleagues in medicine to really go to the websites, look at the CDC guidance, and let's use our common sense. We're the front line, and we need to be MASH-like, and we really need to stand up and help people answer their basic questions. Rule out flu, rule out the other causes. Thank you, everyone. These are long days ahead. They are unusual times. It will be confusing at times. Doing this right, even 80% right, will decrease that blue curve, and it will make all the difference. It won't be perfect. It'll be frustrating because you'll have a little question that you can't get answered. But go to our website, coronavirus.ohio.gov, and we will all begin to do this together. Thank you so much.